Hi, my name is Christina, and first I would like to thank the ICS for the opportunity to present our study. We have nothing to disclose. Strenuous work has been suggested but not established as a risk factor of pelvic floor dysfunction in women. And we know from several cross-sectional studies that female athletes and exercises have 3 times the risk of experiencing urinary incontinence compared to non-exercisers. However, most of these studies are in high-impact athletes, and there is sparse knowledge of pelvic floor dysfunction in strength athletes such as power lifters and Olympic weightlifters. These athletes train and compete with extensive weights, often exceeding their own body weight, and the sports may therefore serve as a model to study heavy load and pelvic floor dysfunction. So the aims of this study was to investigate among female and male power and Olympic weightlifters, prevalence and risk factors of pelvic floor dysfunction, bother of pelvic floor dysfunction and the impact on sport performance, and the athlete's knowledge of the pelvic floor muscles. This was a cross-sectional study where we aimed to include all Norwegian female and male power or Olympic weightlifters of more than 18 years of age who had competed in at least one Norwegian national championship during the 2018 and 2019 seasons. We used an electronic questionnaires, including questions on prevalence and bother of urinary incontinence, anal incontinence, and pelvic organ prolapse, using the questionnaires from the International Consultation of Incontinence. In addition, we had questions regarding background variables, possible risk factors, impact of urinary leakage on sport performance, and the athlete's knowledge of the pelvic floor muscles. We were able to include 180 females and 204 males, resulting in a response rate of 54% and 38%, and these are the main participant characteristics. We found that half of the women reported any type of urinary incontinence, and stress urinary incontinence was the most common subtype, reported by 42%. Anal incontinence was reported by 80% of the females, and involuntary loss of gas was the most common subtype. 23% reported pelvic organ prolapse. And among the males, urinary incontinence was not that common, and only 2 reported stress urinary incontinence. However, anal incontinence was reported by 62% of the males. And also among the males, we found that involuntary loss of gas was the most common subtype. In our multiple logistic regression analysis, we found that only few factors were associated with pelvic floor dysfunctions. In female, increasing BMI was significantly associated with stress urinary incontinence, international level of competition and weightlifting of 4 or more days per week with anal incontinence, and straining to void and chronic disease with pelvic organ prolapse. Among the males, increasing age and frequently straining to void were significantly associated with anal incontinence. These results are a bit different than those reported in the abstract due to some minor changes in the analysis. Self-reported bother on daily living were generally low in both females and males for all types of pelvic floor dysfunction, and the mean scores did not exceed any more than 2.3 on a scale of 0 to 10. However, among females with stress urinary incontinence, as much as 88% reported negative effect on sport performance, and loss of concentration and fear of visible leakage were the most common complaints. About 40% of the females and 70% of the males did not know how or why to train the pelvic floor muscles. However, 78% of the females and half of the males reported that they would do pelvic floor muscle training to prevent or treat dysfunction if they knew how to perform the exercises. So finally, to our conclusion. This is, to our knowledge, the first study to include questions on different pelvic floor dysfunctions in strength athletes, targeting both male and female athletes. We found that the prevalence of pelvic floor dysfunction in the female population and anal incontinence in the male population were high. And only a few risk factors could explain the high prevalence of pelvic floor dysfunction. Self-reported bother on daily living was generally low for all types of dysfunction, but urinary leakage had negative effect on sport performance among most of the females with stress urinary incontinence. The athlete's knowledge of the pelvic floor muscle was sparse. So finally, we believe that our results supports a potential for future high-quality studies assessing the effect of pelvic floor muscle training or other treatment or prevention strategies. Thank you for the attention.